My name's Brian Wise. I'm a consultant in gynaecology and I specialise in urogynaecology. I've been a doctor now for over 30 years and I've been a consultant in East Kent for more than 20 years. I specialise in the treatment of problems of urinary incontinence and prolapse. Urinary incontinence is involuntary loss of urine which is bothersome to the individual. There are two common causes of urinary leakage. First of all, there's stress incontinence, which is the loss of urine, usually with coughing, sneezing, or with any physical activity. This tends to be related to having had children in the past, but not always. The second cause, which is less common, is urge incontinence, which is the leakage of urine which is preceded by a sudden, strong desire to void, which the person can't suppress. Both conditions can be very symptomatic and can impair the quality of life of women concerned. A lot of the diagnosis can be made on taking a good history, so it's very important to listen to your patients carefully and you can identify the symptoms that will enable you to sort the problems out. If a lady has pure stress incontinence, so that she may leak with exercise, running, etc., but doesn't have urinary frequency and urgency, then you can be pretty sure that they have stress incontinence and you can start treatment from an early stage. This might comprise pelvic floor exercises, so in my practice I do work very closely with pelvic floor physiotherapists. If on the other hand someone has urinary frequency, urgency, and they find that they're getting up at night regularly to pass urine, then we think about overactive bladder, which is a combination of symptoms of frequency, urgency, with or without urge incontinence. This condition is slightly different to stress incontinence and is due to involuntary contractions of the bladder, which the woman is unable to prevent. This can result in unexpected large volumes of leakage at any moment. The treatment of this is different to stress incontinence and may comprise bladder retraining or medication to help suppress the bladder contractions. Surgery is an important part of the treatment of incontinence, particularly in those with stress incontinence. My own view is to only operate when necessary and to have tried conservative treatment such as pelvic floor exercises prior to surgical treatment. Many women may know that there's been a lot of controversy about treatment for stress incontinence and prolapse in the last few years, and in particular with the use of synthetic mesh materials. In East Kent, we are in quite a fortunate position that we didn't use a lot of synthetic mesh in the treatment of prolapse, but we were accustomed to using these synthetic mesh slings for the treatment of stress incontinence. At present, we're not using those, like our colleagues around the country, but we are treating women with urethral injections, which is a relatively simple treatment that can be done as a day case under local anaesthesia, and we are able to offer more complex surgery, such as colposuspension. There are procedures that we don't perform in East Kent, but I'm a part of a regional network where we can transfer the care of patients to other consultants within Kent for treatment if required. Well, I'd like to think that it's a good outcome. Not everyone needs surgery, and in particular those with an overactive bladder. They can be managed quite simply by listening to their stories, examination, and then giving conservative or medical treatment. Those that have stress incontinence can often be very significantly improved by pelvic floor physiotherapy. And yes, of course, there are some that will require surgery. Overall, I think outcomes are good with treatment success in the high 70s, 80% region, which I think is pretty good. So it's an embarrassing problem, but when people come forward, often we can help them significantly. So if you have got significant problems with urinary leakage, don't suffer in silence, don't feel embarrassed, pop along and see your GP. They should be able to set you on a path and help you out. If they can't help your problem, then get your GP to refer you to us and we'll be able to assess and treat your problem for you.